Hi, this is Chuck Gallagher, and I'm a director with PCaAware. And I, along with Dennis Golden, the CEO and founder of PCaAware, a national nonprofit, designed to bring awareness about issues surrounding prostate cancer. We're having the opportunity to conduct a series of interviews. Dennis and I both are prostate cancer survivors. And today we're honored to have Senator Dick LaRossa from New Jersey on the line with us, talking about his experience, which is certainly different than Dennis's and mine, in dealing with prostate cancer. And so, Dick, thank you so much for taking the time to join us here today.
No, my pleasure.
Dick, in an earlier conversation, I want to start off with something that really struck me. You said that in your family, I think there were a number of people who had a history of prostate cancer. So tell us a little bit about how prostate cancer was discovered in you, but also a little bit about the family connection, because I think Dennis and I both recognize that there certainly can be a genetic connection that links prostate cancer to at least a number of us.
Right. Well, on the relative standpoint, is I have my brother and three first cousins. There would have been a fourth one, except he passed away, but not from the prostate cancer. But they all were doing their screenings and came to pass that they all came up with prostate cancer. Now, I don't know, excuse me, what the technique was that was used to treat their particular version of the prostate cancer, but I do know that they were all treated. I know one was one was radiation, two were removal, and I don't remember what the third one was. But the fact of the matter is, there's 5 people that are that close together. It indicates that there's something, genetically wrong, and you're only going to find that by looking for it, and you can't avoid getting checked, because it seems like I think the numbers were like 70-80% of men in this country are going to be getting prostate cancer, and they're very lucky if they don't. Now, as far as I'm sorry, go ahead.
No, go ahead. I think you're right in saying that there certainly is, at least from everything that we hear, a genetic component. Some of us are fortunate enough to be able to, well, I say fortunate enough, some of us are able to see that, and certainly that was true in your case. Dick, how old were you when it was discovered, and how was it discovered?
Well, it's kind of interesting how it was discovered. It was discovered in, I guess, 2003 going into 2004. I was treated at Fox Chase outside of Philadelphia. As far as, how it was treated or how it was discovered, I had gotten other screening, techniques done. One of them where they take the biopsy of the prostate, and the first one was done from the front. Second one was done from the back. Well, it was interesting. The first one, they did 6 pieces that they biopsied, and it came back and it said nothing wrong. Well, I was kind of thinking that 6 sounds a little skimpy when you're looking for something like this. Went to see another doctor, and he did another biopsy. He took 20 biopsy pieces, and that was where it came back and definitely showed the prostate cancer. So the fact of the matter, I think the people who are doing the screening for you have got to be more aware of the level of what any family history may be. But the fact of the matter is, if you don't have someone who's going to really look deeply, you could be in a lot of trouble.
That's so true, because you're in a situation many times where your family doctor will do an initial examination, say he doesn't really see anything there, no indication. And a lot of guys at that point say, well, I'm not taking it any further. And you make an excellent point in the terms of really you need to be out there and you really need to look deeper into a situation if you have some suspicion that it's either in your family history or you're starting to see some indications. Sometimes that can be poor performance in bed. It might be increased trips to the bathroom at night. And all of those
Right.
things are sort of indicators that guys kind of tend to overlook. So you were good to pursue that, Dick.
Well, like I said, it's, when you have the numbers come back, and they said my PSA, I think, was around 4, which doesn't sound, awfully bad. But the doctor I was seeing then was because of the biopsy pieces. That's when he said, we're going to need to do something about this.
Now, Dick, once again, what was your age whenever it was diagnosed?
50, let me think for here for a second, 14, 52, I believe.
Okay. So you were a fairly young man whenever it initially was diagnosed. I have to ask the question because I think it's always interesting for guys to know kind of what to expect. When the biopsy came back and it said you had prostate cancer, what did the doctor at that point in time do or suggest to be done in terms of dealing with prostate cancer and treatment?
Well, the doctor that I was seeing at the Fox Chase, we're trying to make a determination as to what's the best way to go. And obviously I reviewed voraciously on the internet the types of prostate cancer, what would trigger it, how progressive it might be. Because one thing people don't understand is that even if you've been treated, it's still something that has to be followed up on. It's not a one and done situation. So when I was meeting with the radiologist down at Fox Chase, it was interesting that after we had it done, I'm sitting in the examining room, and he said to me, he says, "You made the right choice." Well, I was wondering, if I made the right choice now, why didn't you tell me ahead of time that it was the right choice, or give me some hints as to what would happen? I had gone to, I think it was either Cornell or Columbia Presbyterian in New York, and they had taken a look at it, and one of those guys was going to say they wanted to remove it. And I said, I thought you couldn't, do surgery once it's been radiated. And he said, that's basically true. He said, but I can do that. And I said, what are you using, one of these, cyber knife? He said, no, you're doing it manually by hand. And that didn't seem to be a way for me to really want to go. But when doing it by hand, and he said, well, he said he has to be able to feel, what he's looking for. And he said, as far as feeling it, he didn't want me to walk away from it and just say that, that this was good enough. So we went to, we discussed other options beyond that, but for several years, the radiation seemed to have held itself, except for the continency and the erectile dysfunction.
Now,
so there were a lot of things going on that were not right.
Dick, let me ask this question. It's kind of funny for those of us that have had prostate cancer and dealt with treatments. We take it as it's old hat, and we know what took place, and sometimes we miss a little bit in the fact pattern. I want to go back to. I'm sorry, but I have to do this. I want to go back to the beginning. What did the doctor say whenever you were diagnosed that caused you to choose radiation versus surgery for a person that was 52 or in their early 50s?
Well, quite frankly, they never really gave me an option from the doctors at Fox Chase. It was based on the reading I did, all the brochures and pamphlets and so on, and that seemed to be they use a thing called IMRT, and the IMRT seemed to be a good option because of how precise it can be. Well, now we find after the fact it's not as precise as we thought. But again, it had to be dealt with, and the decision in terms of making the radiation the choice, I think it was a matter of I just didn't want to have any more surgery and have anything taken out. I want to go out with everything in me.
Hey, Dick, another question I've got there. Did that hospital primarily specialize in radiation? Because we've heard from so many people that sometimes a hospital will specialize in surgery, another in radiation, another in another type of treatment. And sometimes, patients are, I want to say, almost shepherded into a treatment protocol. And as we discussed that at the conference that we were at, so many times the patient is the least informed person in the room, and you are the one making the decision or telling your doctor which treatment protocol do you want. What was your experience with that, Dick?
In terms of what?
Well, in terms of, did you find that the hospital did an awful lot of work in the radiation area, or were they really able to do all different types of treatments there?
No, all different kinds of treatment. Everything from breast to blastomas to brain cancer to colon cancer. They were, but they only dealt with cancer. That was their only procedure that they were, or the only malady that they were dealing with.
But primarily through radiation.
No, they had surgery available as an option, and nobody ever. See, the thing is, nobody ever told me about the cryoablation. I found that out on my own. So when you talk about being the least informed person in the room, I really have to wonder if the doctors, when they're looking at these things, are really looking at it from a holistic standpoint, so that every opportunity can be legitimately explored. But the difficulty is that they're not giving you all of the information and all of the options that are available. And that's what's frustrated me, because everything I seem to have done was not to say fruitless, but it didn't have the totally getting rid of it as it was, because my PSA is back up to a little under 2, like 1.8 or 1.9, and that doesn't thrill me. Matter of fact, the doctor said to me, he says, don't worry about it. He says, you're not going to die from prostate cancer. It's going to be something else. And I said to him, how can you be so sure? He said, it's not that far along. And the fact of the matter is, you're getting treated, you're being followed, and as long as you stay on top of it, you'll be fine. So, all you can do is take his word for it. But again, it's still, I find a little disconcerting to know that there were a number of different opinions.
Dennis, I think for you and Dick, one thing, and probably more for the listeners, quite frankly, I think we know this, but for the listeners, it's incredibly important to explore, before you make a decision, all of the options. And I'm going to be very blunt in this statement, but if I'm a doctor and my specialty is surgery, I'm going to lean towards surgery because that's what I'm good at. If I'm a doctor and I specialize in radiation oncology, that's what I'm going to recommend. That's what I'm good at. If I'm a physician and I'm good at HIFU or cryoablation, then that's probably what I'm going to recommend. The problem is, now I'll say this, this may be inaccurate, but there are very few physicians who are competent in all modalities of prostate cancer treatment. So
I would totally agree with you.
So knowing that to be the case, if you've been diagnosed with prostate cancer, do not listen to the doctor as if the doctor is God. They are God for their specialty, but there's multitudes of specialties, and it is incumbent upon the patient to explore those options and make a determination more so than it is to assume the doctor is going to lead you down a path that is perfect for you.
Right.
Now, you raise a great point, Chuck. You know, one of the things too is it's so easy to go to the internet and get information. And many times what you get is not very accurate. And one of the things that we recommend is to talk to other men who have had prostate cancer and who have had different treatments. I think one of the first things that happens is when you're diagnosed with cancer, your first reaction is abject fear and how quickly can I get this out of me? But except in the rarest of cases, you have time to do a little bit of research, talk to other men, get involved. And, you know, you can go to the internet and you can get, as I said, some very poor information. But I think if you can get into an organization like we do here at PCaAware, where there's information available to men on a channel where they can see, where they can really get a better understanding of what's really available is really important.
Yeah, I think that where I have a divergence of excuse me, of opinions with doctors was when that one biopsy only took 6 pieces to do the biopsy. You know, I kind of thought at the time that it was a little meager in terms of the different kinds of places they should be going. But the fact of the matter is, when they got in there, and they said, and then they tell me after the fact that I made the right decision, and now I'm looking back at it and saying, well, I wonder if I really did make the right decision. So it's a little disconcerting.
Dick, you said, and I know this is a bit personal, but you said that after your initial treatment, which was radiation,
Right.
IMRT, radiation, that you experienced incontinence and erectile dysfunction. If you don't mind, talk a bit about that. When did the incontinence clear up? How long did it take? And how long did it take for the erectile dysfunction to clear up or improve?
Well, the incontinence probably started maybe about 6 to 8 months after I had the radiation, and it's been with me ever since.
Okay.
So, you know, I had literally 2 days ago, I had an interstem device removed because I have to get an MRI. And I don't know if you're familiar with the interstem device, but it's something they put in your back, and it's supposed to help for bladder control. And it's interesting because to get an MRI, you can't have any metal in your body. So that's another thing to consider, that if somebody's going to do testing, is make sure they do all of the testing, not just CAT scans, not just body scans. You know, they should do a complete series of MRI films, because I think that there were some things that, you know, might have been missed because of it had progressed, you know, fairly well down the road. Now, I find it interesting, and I mean, I've heard people who have, you know, PSAs where they're getting into the 10s, 20s, 30s, 50s, et cetera, and, you know, they're fine. And, you know, mine wasn't even 4, but when he did the biopsy, he told me, he said, yeah, you definitely have cancer there, and you need to do something about it. So from that standpoint, he's a, you know, pretty good guy. And he's also the one that after the fact got me in to see this fellow up in Boston. His name was Steven Cianti, and he's the master of cryoablation. So I had that treatment as well, and that helped for a little bit. But I don't think there's ever going to be a full-blown you know, cure where it's ever going to be out of me.
Now, your let me make sure I've got this correct. You had radiation treatment at the outset, and I think you said, if I remember, that lasted. When I say lasted, for those people that are listening or watching, lasted meaning that your PSA was substantially non-existent, and then it began to creep up. And I think you said that was it took about 3 years for that. Was that correct?
Yeah. Yep, that's about right.
Okay. And then once you began to start seeing the PSA creep, you sought an additional treatment, and that, in your case, was cryoablation.
Right. Well, what I had done is the only thing in the middle of that was when I had gone to Columbia Presbyterian or Cornell, and where the one fellow suggested surgery, and when he described what he was doing, because he had to be manual, because he had to be able to feel what he was feeling. He said, "Yeah, it's tricky." He said, "It's kind of like trying to separate two slices of cheese from a grilled cheese sandwich," and that didn't appeal to me as far as being a stable way to go. I mean, if you try to separate two slices of cheese on a grilled cheese sandwich, and that's what they want to do in your body, I would be a little reluctant to go that route.
I can understand that. Now,
Yeah, I mean,
Dick, in terms of, I mean, you've been on the New Jersey Senate, and have you had any conversations with other senators, other lawmakers in New Jersey regarding prostate cancer? And, we all recognize that it's a disease many times that is overlooked. Many men don't talk about it. They don't want to speak up about it in any way. Have you moved in any of that direction at all? Have you seen any movement in that direction?
I've seen no movement in that direction at all. It's the closest it comes is the what you'll see on TV or a radio ad or so on, in terms of prostate cancer and get checked, get screened, and so on. But as far as anybody in the legislature, I mean, they have Women's Awareness Day for breast cancer, but again, it's almost as though prostate cancer is being totally ignored by the legislature. If you got cancer, you've got cancer. I don't care what kind it is. It's got to be treated, and somebody better know what they're doing in terms of making a decision.
Is there any way that we can, from your point of view, make men more aware of the need to speak up and speak out about this, either locally or at the national level?
Well, I think that there's the people who have prostate cancer don't know the seriousness or the significance of what it is. I think that what happens at some point in time is the reality sets in, and then they get a little bit scared, and then they start looking around, and they don't make decisions based on anything that's present or confronting them in the face. What's happening is that it's confronting them, but it's how you got there is an interesting question. I mean, I don't know if I had gotten into it even earlier. I mean, I was like stage 1.5, stage 2, which again doesn't seem to be a lot. But I mean, I've been through a lot with the the testing and the treatments and so on. And to this day, none of the treatments have totally knocked out the full-blown effect of the screening and the radiation and the cryoablation. I mean, I don't know if I see myself having another procedure, but again, it's difficult. There's been no movement in the state at all, and that's pretty frustrating.
When you look at Dick and Dennis, what takes place, I think one of the things, Dick, that you said is, there's just not a lot of talk about it. And that's really unfortunate. You do find from time to time someone with celebrity status or sports status that acknowledges perhaps that they have prostate cancer, but it tends to go to treatment and then to silence. And I think one of the things that PCaAware does, and part of what this series of interviews is designed to do, is to have an open, practical dialogue with those of us who have been diagnosed with prostate cancer and have survived prostate cancer, to talk about the practical aspects of what this disease does and how it works, and things that might be helpful to others. Dick, I've got to ask, if you could do it over again when you were initially diagnosed, what would you do different?
I would probably come up with a different set of questions. And then once that occurred, my choice of treatment probably would have been surgery.
Okay. Now, you said a different set of questions, and I know this is putting you a bit on the spot, but what are some of the questions that you would like to have asked, but perhaps didn't initially?
Well, the first question is, how high is high when you get into the rating or the numbers that are on your PSA? I mean, I've heard, like as I said before, many people who go and get their biopsies, and they'll get the PSA, and they'll find out that it's 6, 7, 8, whatever. But that's the question would be, if I let this go, what is the ultimate outcome going to be, and how long is it going to take to get there? That's a difficult question because, I'm sure I had very confident docs, but I think you hit the nail on the head when you said somebody who does surgery is going to lean towards surgery, somebody who does radiation leans towards radiation. But again, the doctors I had did not try to talk me into anything. They just kept presenting information, and I'm not a doctor. So how can I, synthesize the information that they're throwing at me and know that the decision I made was, quote unquote, the right decision for me? And I think that's something which people are not being aware of. It's not the right decision. It's the right decision for you. And I think that going back to what I said earlier, if it's the right decision for you, then you've got to be asking questions about how long is it going to last, what's it going to do to continency, what's it going to do to erectile dysfunction. There's a whole lot of things that are affected by the prostate that very few people know about, or very few men know about. And quite frankly, as much as I've been following it, I still am a little bit in the dark about all of the things that that could happen or could be done, to treat this. And again, the thing that what's going to happen is that HIFU, I think, is going to become the standard, and hopefully that will be a little bit better in terms of getting an idea of treatment and a treatment that's going to last. We're not going to see these creeps in the PSAs.
I think one of the things that happens too is so many times men are told, prostate cancer is a disease that's not going to kill you. It's the best cancer you can get. And I think a lot of that has not done men very well in terms of them understanding how serious this disease can be if not treated and if not detected early. And you have the National Task Force, National Preventative Services Task Force, actually making recommendations that men don't need to be tested for prostate cancer until they're into their 50s. And we know today that men in their 40s are getting prostate cancer, and we know that even some men in their 30s are getting it. So it's really important to really start to understand what this disease is, that if it is caught early, there are better treatment options, and that you as a patient are pretty much responsible for trying to find out as much as you can and not panic in the process.
Yeah, absolutely. Absolutely. Again, there's so much information flying around, but the question is, you go to the internet, you don't know who wrote the article and what the credentials are. Do you go to your family doctor? Do you go to a urologist? Do you go to an oncologist who is, practicing in a cancer treatment hospital? There are so many different ways to go, but I think the awareness has got to be to get men to ask questions about prostate. But the fact of the matter, I don't think they're educated enough to ask the proper questions.
Dick, let me ask you a question. From the time you were diagnosed, how long did it take you to get your treatment, initial treatment?
Less than 6 months.
Okay. And the reason I ask that question is I would like to say to men, unless you are diagnosed with advanced prostate cancer, now that to me takes you into a different world. If the doctor says you're diagnosed with advanced prostate cancer, it's fast moving, I'm going to tell you what I'm getting ready to say is irrelevant. But if it's like the three of us, and we're diagnosed with prostate cancer and it's not deemed to be advanced prostate cancer, I would honestly encourage most men to delay their treatment for at least 6 months. And the reason for that is twofold. Number one, I think you need to take a breath and explore what the options are. For me, Dick, and mine was diagnosed back in 2004. Ultimately, I had surgery, but I gave serious consideration to robotic surgery, which is what I ultimately chose. And I'll tell you why in a moment. HIFU, which was at the time not really available in the United States. So I had to go on out of the country for that. And radiation, and I immediately eliminated radiation because of the simple fact that in the event that radiation failed, surgery functionally was not an option. And so I wanted to, best way to put it, improve my odds. So considering HIFU was only available out of the country at that time, and insurance would cover surgery, robotic surgery at Johns Hopkins, that's what I opted for. But like you, I ended up, 9 years later with PSA creep, started to creep back up. But because I chose surgery on the front side, then I was able to have, IMRT radiation on the back side. And it made intelligent sense. I'm not saying, by the way, for anybody listening, that just because that's what I chose is right for you. You need to pick what's right for you, but take the time to explore it and become comfortable with the choice that you make, as opposed to the doctor. I'm not saying this in a negative way, but playing on your fear, because I've heard so many men say to me, I just want this out of me. And they proceed quickly to make a choice, which later they look back and say, given hindsight, maybe I would have considered something else.
Yeah, I would absolutely agree with it, because hindsight, the more you know, the more you start questioning what you did previously.
Absolutely correct. Now, at this point, I think you've said you've had the two forms of treatment, radiation and cryoablation. Perhaps, because I don't know many people that have had cryo, perhaps it would be worthwhile in this conversation to explain a little bit about what cryo is and how that experience played for you.
Okay. Well, cryoablation, as opposed to radiation, which radiation is burning everything, cryoablation is freezing everything. And it's the surgeon who is doing it goes in with needle tips that were dipped in, I think, in liquid nitrogen or something, one of those solutions. And then they treat the perimeter of the prostate in an attempt to freeze everything, and hope that the freezing gets rid of the last vestiges of what the prostate cancer is. Like I said, if I had known then what I know now, I don't know that it would be initial form of treatment, but it would certainly open up the door to something else for me to explore. And I probably, like I said, 20/20 hindsight now is, if I had it to do all over again, I wouldn't take radiation. I would opt for surgery.
Okay.
How was your recovery from the cryo? Was that a one-day event, or was it a long recovery after that?
Yeah, it was one day event. A friend of mine drove me up to Boston, and they did the treatment in the morning, like 8, 9 o'clock, and we were on our way home by 1 o'clock in the afternoon.
Wow,
that's amazing.
And Dick, what was your recovery after radiation? Since that was your primary method of treatment to begin with.
Well, it was fine for several months, but I wouldn't say that it was fine for a year. It left, after about 8 to 10 months is when the continency started again, and when the erectile dysfunction, came on full bloom. So, I mean, that's the other thing. If you want to still be able to function, I would stay away from, what am I looking for? I would stay away from the radiation.
Now, one of the things I would say, and this is predominantly for people that would be listening or watching to this, is both of those issues. Number one, when you're diagnosed with prostate cancer, you typically immediately think, oh my gosh, cancer, that's a terrible thing. We need to do something to fix this. I do not diminish that. I think that is true. I would take my time. But I would also then say that when it comes to erectile function or when it comes to incontinence, it has been phenomenally interesting to me to find out what different men have experienced. And I say that, Dick, to you because I had in 2014 radiation as a secondary form of treatment because of PSA creep. And in my case, it did not impact incontinence. And, I'm in 2016 now, so it's been literally 2 years now.
Right.
Or it really did not have much impact. It might have had a minor impact on erectile function. The surgery certainly had some impact.
Right.
It wasn't impossible, but it wasn't as if I was before the treatment, certainly. And certainly not like I was when I was 17. But then again, when you're in your late 40s or early 50s, I don't guess you could ever wish to be that virile again.
Yeah, absolutely.
But, the reality of it is it does impact people in different ways. And I think it's important to recognize it can have a significant impact on incontinence or erectile function, or it can have a minimal impact. Certainly you need to be prepared for and aware of what could take place and what you can do to help improve either of those.
Well, I think the most important thing, which again men tend to ignore because there's not a lot of attention being paid to it, is get checked.
Yes.
I mean, it's that simple, and make sure that if they're going to do a biopsy, that you know how many pieces that they are taking to biopsy. Like I said, the first guy took 6, the second guy took 20.
Right.
So I mean that.
But by the way, I'm curious, for the biopsy, were you sedated at all?
No.
Neither was I. And I think that is the worst thing in the world. It's like, oh my gosh, I am on such a mission. It's like, give me propofol and knock me out. If you'll do that for a colonoscopy, good. For God's sake, do it for a biopsy.
Absolutely. Absolutely. I mean, it's, you get that sound of the snip and that little piece of discomfort every time they snip it. And I don't know whether it is your body reacting or whether it's your ears reacting, but it's disconcerting to have that sound and then to have that sensation where they're cutting.
You are a very nice guy, Dick, in the way you put that. I thought it was one of the worst experiences of my life.
It was awful, and I've had 3 of them.
Oh.
I sort of lucked out, guys. I hate to tell you this, but the hospital that I went to actually injected a type of Novocaine in there. And so that did improve the situation. And there are some hospitals doing it and some are not doing it. I've talked to a number of men like both of you guys who have said the same thing. There was no sedative involved, and they really should be. And I think it's important that really, takes some of the fear out of men doing these tests.
Yeah, well, it's kind of like you hear that sound and you get the sensation, and it kind of, while you're able to tolerate it, it kind of gives you the willies just by feeling the sensation of the snipping as well as the sound of it as well. I mean, I don't know which is worse, hearing it or feeling it.
It's all the same.
I don't know, but I think every urologist, before they're ever eligible to practice, ought to have a biopsy of their prostate just so they know what we have to go through.
I would agree. I would agree. I think too many of the doctors tend to be a little more pontificating, and they're using what their training has been, what they tend to lean toward, and what they've done in the past on their own, treating other people, and without them having the experience, that wonderful experience of the biopsies and the psychological part of it. They need to find a way to really impart a different set or different kinds of information to the patient, because the information is few and far between, unless you're looking for a very specific piece of information, which is what you're doing with PCaAware. There aren't too many sources that are going to be able to tell you what the pros and cons are. And I mean, the doctors will tell you what the pros and cons are, but that's based on the people that they've treated. It isn't based on anything that they themselves have experienced.
Well, it all goes back to the point you made earlier, Dick, which is really, get information, find out information, and just, look more deeply in before you're making a decision. And that's the same thing with the biopsy. There are hospitals now that are using the standard biopsy techniques. There are other hospitals that are using a whole guided biopsy, which is a whole different system and far more accurate, rather than sort of the hit and miss system that so many hospitals still continue to use today.
Well, like I said, whatever opportunity they have to get an accurate biopsy and then be able to come back and make a recommendation, or I don't understand why they would not make a recommendation, but after the fact they would tell me I made the right choice. Well, this is 3 months after I had the procedure, and now they're telling me I made the right choice. 3 months to me is a little bit short period of time to be telling somebody that you made the right choice.
Well, Dick, that's true. And, in all honesty, I think we all can be real practical and candid here. If I'm a doctor, I should tell you you made the right choice, because if I tell you made the wrong choice, that may create a liability issue for me. And that's likely something I'd want to avoid. So I would be shocked if I ever heard a doctor say, well, Chuck, that was really the wrong choice you made, because I'm going to say, well, you're the one that suggested it, and we're going to have a legal problem.
Absolutely. It amazes me. My urologist is, he's pretty bright guy, and he's up on basically anything. As far as controlling the continency, that InterStem device is what they put in. There's electrodes that are hooked up to, I guess, the bladder somewhere, and then there's an external device where you can set the amplitude, higher or lower, depending on, how much the continency is troubling you. But I mean, that's something that can help a lot as far as continency goes. I don't think they've come up with anything for for the erectile dysfunction yet.
Dick, before we wrap things up, let me ask one other question. You said that now after 2 treatments, you still have some PSA creep, and I think you said it was maybe 1.8 at this point. How often are you going to get that checked, and how rapidly are you seeing that rise? I'm
getting it checked every 6 months, or is it? It's either 3 or 6 months. But we'll say 6 months. And as far as the creep, there was a point where it went down to well below 1, like 0.85, and now we're a whole digit higher at 0.8, at 0.28, or whatever, however they want to portray that. But the fact of the matter is, you just need to follow this stuff, and without knowing what the test and the biopsies are telling you, you need a translator, and that translator is the doctor, and that doctor is going to be recommending, as you suggested, a process that's going to be more akin to what they're used to or what they logically would want to do.
Dick, do you have what I would refer to as a treatment team there, or are you really dealing with individual physicians that are sort of isolated, making recommendations? You know, if your PSA continues to go up, have anyone outlined to you a path to follow going forward?
No, nope, because we've already done the cryo and we've done the radiation, and the thing is, the radiation makes it very difficult to come up with and use any other technique, and that's frustrating.
Because some of the breakthroughs right now in some of the clinical trials that are out there, have you had any success looking at clinical trials or
No.
in any of the genomic types of things that are now available?
No, not at all. I haven't, quite frankly, the stuff that comes up on like Yahoo News and on the internet and so on, it would be a nice conduit if that information was there. But I haven't seen too much printed on any new techniques in a long time.
Well, one of the things that I think, Dennis, is important, and part of what I believe PCaAware can do through this series of interviews and blogs and other things that are taking place, is to at least expose the concept of where we can go as men who have been diagnosed with prostate cancer and what options are. And Dennis, to your point, I think it's incredibly interesting that there could be a team, and perhaps in many cases should be a team of physicians that look at what the options are and where the person is. And to that end, I will say, when I went back for salvage radiation, some 9 years after my initial surgery, there in fact was a team. And that team included a multitude of people who all worked in the cancer arena, but had different areas of specialty. And one of the things they did is they put the circumstance of the patient into the team discussion so that there could be a consensus opinion as to what the treatment should be, taking away the issue that we've talked about earlier, which, is X-doc might have a propensity for one thing. The team approach is a more holistic approach to what's going to be the best treatment for Chuck based upon his facts and circumstances. And I will tell you that did give me a great deal of satisfaction.
I think you're starting to see more of that in hospitals, and I think the reason for that too is the fact that hospitals are being held accountable for the treatment and the follow-up treatment. I mean, how successful have you been? Pharmaceutical companies. Dick, you and I were at a symposium there where we were with a pharmaceutical company talking about how the pharmaceutical companies are trying to form teams like this and trying to get more information out to patients. How do patients make decisions and what do they need to do? So there slowly seems to be a coming together in the private sector of organizations trying to do this on a more aggressive basis and to the benefit of the patient, certainly.
Yeah. I think the knowledge is a very valuable thing. But the thing is that what I should have asked is that of the fellow that was treating me is, what is your specialty? Is cryo your specialty? Is radiation your specialty? Is surgery your specialty? That's an interesting question. But how often are you going to be in front of the treatment people and then have them turn around and give you that kind of information? Not going to happen.
Well, one thing, and let me close with this. Dick, first, thank you for taking the time. I think that this has been incredibly valuable because you have brought to our series of interviews a really new and different perspective. Not only, did you start with, at a fairly early age, a different form of treatment, but certainly you're one of the few people that I've talked with over time that has used cryo as a method of treatment as well. And your candor and your honesty has been, I'm sure, very helpful, because I think things that men have heard from this interview, taken to heart, will certainly make a difference. And with that, Dennis, I'm going to turn it over to you, because as CEO and founder of PCaAware, I think you can close us out with some words of wisdom.
Well, I think the words of wisdom more than anything else are: men need to speak up, men need to get involved, and you need to be tested. And it's an ongoing basis. And it's something that I think if men realize the importance of this, they wouldn't ignore it. And you look at the tremendous number of resources that go for breast cancer because women speak up. And what we find consistently is men don't speak up. The pharmaceutical companies hear that. The physicians hear that. Legislators hear that. And in the long run, men are being shortchanged. So thank you so much, Dick, for really speaking out with us today. And Chuck, thank you for all of the work that you're doing with us here at PCaAware and the Foundation. And certainly we hope that people listening will take a few minutes to visit our website at www.pcaaware.org. And if you have an opportunity to make a contribution, to help us out, to get the word out to more and more men, to underwrite programs like this, we'd really appreciate your support.